Hey there, welcome back to the channel. Today we're diving deep into a life-saving procedure that you might have heard about, coronary artery bypass grafting, or CABG surgery. Every year, hundreds of thousands of people undergo this surgery to restore blood flow to their hearts, and we're going to break it down for you step by step. Let's get started. This is why you need to understand coronary artery disease. Viewer discretion is advised. The content in this video includes medical procedures and is intended for mature audiences. The heart, like any other organ, needs a constant supply of oxygen-rich blood. That's delivered by the coronary arteries. But over time, due to factors like high cholesterol, high blood pressure, and smoking, these arteries can get clogged by plaque, a waxy substance made up of fat, cholesterol, and other materials. This condition is called coronary artery disease. So, how do surgeons fix this problem? Well, CABG surgery is like building a new highway around a traffic jam. Surgeons create a new pathway for blood to flow by using a healthy blood vessel from another part of the body, often from the leg, chest, or arm. Now, CABG is a major surgery, and it's most often performed as open heart surgery. This means the surgeon opens the chest to access the heart. During the procedure, a heart-lung machine is often used to take over the job of pumping blood and oxygen while the heart is temporarily stopped. In some cases, however, surgeons can perform an off-pump bypass, where the heart continues to beat during the surgery. The entire procedure usually takes between 3 to 6 hours, depending on the complexity. It's performed under general anesthesia, so the patient is asleep and doesn't feel any pain. So, what happens after surgery? Recovery is a journey. Patients typically spend 5 to 7 days in the hospital, including a few days in the intensive care unit. Here, doctors closely monitor the patient's heart function and vital signs. During this time, patients may have tubes in their chest to drain excess fluid and a catheter to monitor urine output. While it sounds intense, these are routine parts of the recovery process. After leaving the hospital, the next phase of recovery begins. This is a critical time for healing. The first 6 to 12 weeks involve a mix of rest, gradual physical activity, and cardiac rehabilitation. Cardiac rehab is a medically supervised program that helps patients regain strength and learn how to keep their heart healthy long-term. You'll work on lifestyle changes like eating a heart-healthy diet, exercising safely, and quitting smoking. Of course, CABG surgery is not without its risks. Like any major surgery, there's a chance of complications such as infections, bleeding, or blood clots. Some patients may experience memory or cognitive issues, sometimes called pump head, although this usually improves over time. But the benefits often outweigh the risks, especially for those who are at high risk of a heart attack before surgery. With successful CABG surgery, the heart receives more blood and oxygen, which can reduce chest pain, improve heart function, and greatly lower the risk of heart attacks. The best part? Many people go on to live healthier, longer lives after surgery. So there you have it, a comprehensive look at coronary artery bypass grafting, a surgery that gives people a second chance at life. Whether it's a double, triple, or quadruple bypass, this procedure can make a world of difference. Thanks for sticking around. If you learned something new today or know someone who might benefit from this info, don't forget to like and share this video. And if you have any questions, drop them in the comments. We'd love to help. Subscribe for more health and science content, and we'll see you in the next video. Stay heart healthy.